Vibrio are gram-negative facultative anaerobes. They are curved, rod-shaped. They are motile. Most have a single polar flagellum when grown in liquid medium. Many Vibrio species are pathogenic to humans and have been implicated in foodborne disease. Vibrio species account for a significant proportion of human infections from the consumption of raw or undercooked shellfish. Vibrio illnesses are among the two bacterial foodborne diseases that were higher in 2014 than in previous years, the other being Campylobacter jejuni, while rising temperatures have been implicated as a possible reason for this. Scientists emphasize that additional research must be conducted to pinpoint the reason for these trends. Vibrio vulnificus is a halophilic pathogenic bacterium of the genus Vibrio. This bacteria is most prominently found in raw or undercooked shellfish, particularly oysters. Infections typically occur in areas with warm, brackish, and salty waters. In the U.S., this bacteria is most commonly found in the Gulf Coast states. Increased incidence of infection is observed during warmer months, with over 85% of cases occurring between April and October each year.
Anyone who consumes raw or undercooked seafood may be at risk of contracting V. vulnificus. This is especially true if an individual lives in or around the Gulf Coast states. Those with compromised immune systems face an increased risk of contraction. Pre-existing medical conditions, especially chronic liver disease, may facilitate or intensify infection. Individuals with open wounds may also contract an infection if their wounds are exposed to contaminated water or shellfish. Males are affected significantly more often than women. The reason for this is unknown, although some experimental studies suggest that the estrogen hormone may provide protective effects against this bacterium. Vibrio vulnificus may cause 3 different types of infection. The first type of infection is acute gastroenteritis acquired from consuming raw or undercooked shellfish, especially oysters. Symptoms are vomiting, diarrhea, and abdominal pain. The second type of infection is wounds or open skin exposed to contaminated seawater. The symptom is blistering skin lesions. The third type of infection is invasive septicemia in individuals with compromised immune systems, especially those with chronic liver disease. Symptoms are blistering skin lesions, septic shock, and sometimes even death. The total mortality rate among all types of infection is approximately 33%. The CDC has received reports of more than 900 cases of V. vulnificus. In many cases, the infection may not be specifically diagnosed as V. vulnificus. While some cases can be culture confirmed, education and reporting measures are still relatively limited. As a result, it's believed that many cases go unreported. The American Medical Association and the CDC recommend treating the patient with antibiotics. In severe cases, amputation of an infected limb may also be necessary.
We can prevent the contraction of V. vulnificus by educating people on the risks associated with eating raw and undercooked shellfish. Along with that, the education could include how to properly cook shellfish. Since Vibrio prefers warm conditions, shellfish must be refrigerated from harvesting to consumption. Oysters should be put on ice immediately after harvesting. This chart shows the overall growth of Vibrios from oysters over a 10-day period at varying temperatures. The least amount of growth was seen between 5 and 10 degrees Celsius, showing that storing oysters at the correct temperature lowers a consumer's risk of contracting Vibrio. Another way Vibrio is being prevented in shellfish is through high-pressure processing. This accomplishes 2 things. It inactivates the Vibrio so the shellfish are safe to eat, and it denatures the proteins so that the mollusk open up for easy consumption. Additionally, those who could easily contract Vibrio vulnificus should avoid raw oysters and clams. They should also avoid marine waters if they have any type of skin abrasion. Reporting an infection from this microbe quickly will help the CDC and FDA track down the source and prevent the spread of it in a timely manner. For the Gulf Coast states, each year an average of 50 cases, 45 hospitalizations, and 16 deaths are reported. Nationwide, there are as many as 95 cases, 85 hospitalizations, and 35 deaths. As mentioned earlier, most of these cases happen during warmer months.
Created using Powtoon.